Welcome to Make an Informed Decision. I'm Tom Burton, proud to say that I'm superintendent of Princeton City Schools. Earlier today, we had a great Facebook Live event, our first one in two-part series about making an informed decision at noon. During that time, we went about an hour and 18 minutes. Chris Lockhart, Director of Technology, told me that, an hour and 18 minutes and 30 seconds. So we taped that program. And so we're going to replay that, as the vast majority of the programming itself is a presentation. However, at the very end, there was a question answer session, and there are great questions that were asked, and then furthermore answered. So we're really excited specifically to answer all those questions. Please stay tuned through the whole program. We're going to come back live at the very end of it, about the hour and 18-minute mark, to answer any questions that you may have. So please make sure you put questions in the chat box throughout the whole presentation. Any questions that you need answered, we're going to do our very best to make sure we give you very specific answers throughout the whole program tonight. So without further ado, this is the complete videotaping of our noon session about making an informed decision. Today is specifically designed to help parents get information they need to make an informed decision of whether or not to choose a traditional or alternating schedule coming back to school or remote learning. So there's really only two options that you have. One is that however we determine to come back face-to-face, you're going to be okay with that. Or two, to go to remote learning. So let me just give you some data right on the front end to let you know so far how things are going with our surveys. So we have roughly around 20% of our students that have filled out our survey. Now, I know some of you are saying that it went to parents, but that's how we have to look at it. So we have 20% of our student body, which would mean that parents of 20% of our student body have filled out our survey. So thus far, we have about 240 students and parents that have chosen the remote learning option. So one of the reasons why I wanted to put forth this Facebook event was to make sure that you had as much information as possible. When we first turned out the survey, we did have some parents that reached out and they said, boy, we'd like some additional information about not only what remote learning is and how that's going to look, but also what's going to happen if we choose to send our son or daughter back to school. So this is the intent of today's Facebook event, to provide as much information as you possibly can to help parents make an informed decision. Now, we do know that even after everything that we do and answering questions, as well as presenting today, even if you still need additional time, that's going to be okay. But ultimately, some parents are ready right now to make a decision and have made a decision of what they're going to do, remote learning for a semester or the entire year. So we know right now that the numbers we have, but we need as many people as possible. Actually, we need every single parent to fill out the survey so that we know what it's going to look like. We would prefer bring everybody back all at once. That's what we want, so that there's no alternating weekly schedule. That's going to be the best case for our students, so that they don't have to do the remote learning. But this is what we know right now. We know that at any time, we're going to need to be able to snap our finger and go remote if there are situations that occur. For instance, if we were to go to purple on the rating scale that now we have across the state. So Hamilton County is red right now, which shows that reproductive value, the number, is continually getting higher, and we have more people that have tested positive for COVID. So to help eliminate the spread of COVID, we may need to go to remote learning right away. And so this is going to provide as much information to each parent. And again, if there's questions, you can put them in the chat box. We do have many people that are on the call as well, are on the Facebook, the event, the Zoom, if you will. So we certainly appreciate everybody for being on the Zoom. And we do have two special guests that will be providing some additional information later on. So as you move to the next slide, just very quickly, as you know, our mission statement is very clear: empowering each student for college, career, and life success. Over the springtime, I think our students, our parents, and boy, our teachers, staff members were heroic in an effort to contact each and every student to make learning continue to happen as seamlessly as possible. So again, I applaud all those that I just mentioned for the great work that they did in staying as current as possible, providing innovative and engaging lessons. So let's move on and get right into the nitty gritty. So today, when you talk about the next, what we're specifically talking about, so remote learning, but we're also going to get down deep in, and Matt Clayton and Amy Ellis, thank you so much for joining us from the Springdale Health Department. They're going to provide a lot of information around what does it look like with social distancing and the importance of that. We'll talk about cleaning. We'll talk about our mask policy that we will have, but we'll talk about how that looks, our cleaning, what that looks like, how we're going to sanitize our transportation, as well as some supports that are absolutely critical that we know of. So let's move on to the next slide, where we'll specifically talk about what's not going to be covered today. So we do know that there are several teachers and staff members on this call, on this Facebook Live event. Please know that we're going to next week have some optional opportunities to be able to participate in other events, Zoom calls, to be able to learn a little bit more, to be able to get a little bit additional information, and specifically our reopening task force will be able to process additional information. We'll still be involved in decision making as you move forward, but we need to get as much information to parents as possible. So for the teachers, staff members, administrators on this call, you know that we've been communicating as much as possible, as quickly as possible. But this information today is specifically for parents to make decisions on remote learning. We still know that there are many decisions that need to be made, what's going to happen specifically in each classroom, in each building. But a huge shout out to all the principals, assistant principals, directors, coordinators for all the great work that they've done already putting together plans. So for the parents' perspective, please know there are spreadsheets that our principals have worked on feverishly, talking specifically about what does social distancing look like? How's it going to look with transportation? How's it going to look with transporting kids in general, drop off, pick up, and specifically, what does it look like transitioning in the building? So we'll talk more about that later. But as always, if you have questions, personal questions, you could call us at 513-864-1100, and you'll be directed to the specific department to help you. But if you just wanted to leave a message, we can do that for sure. You could do that for sure at our hotline number, 513-864-1162. But prior to doing that, I would encourage you all to go to our frequently asked questions portion on our website, which is, you can find that at www.princetonschools.net. So let's get into some specifics right now. So this is to help, again, make all the informed decisions. We'll go over some schedules and flexibility. And again, this is all about you making an informed decision for whether or not you're going to send your child back to school, however we deem fit. Quite frankly, traditional is basically where we're going to go. But depending upon social distancing and some other things, based upon the numbers that we have in the survey, that's why that survey is critical. Because if we have enough people that determine to go to remote learning, then we'll be able to bring everybody back in traditional setting. And then also, just as a timestamp, that this is current information as of July 9th. That's really relevant because things change so much. So let's talk about some certainties. We plan on returning to traditional school based on our ability to socially distance in schools. Again, just as a reminder, our Innovation Center students will start the year remotely. Our remote learning requires at least a 1 semester commitment. But as of right now, many people are committing for the year. And then we've recommended to the Board of Education, and that we have a board meeting on Monday, this Monday, July 13th. And we know that if approved, there's a couple things for certain. One, that we're going to add 5 days of professional development and teacher prep time. And here's why that's so important. Because again, at any point, If we go purple in the county, we're told that we really need to shut down and go to remote learning right away. Or if we make that decision, we need to have all of our teachers be able to flip the switch so quickly to go to remote learning for each student. So that's why that extra time is so critical for both professional development and teacher prep time. The other recommendation that we have for the Board of Education are those 2 days that we have during Thanksgiving break. If you remember, we're typically off school that Wednesday of Thanksgiving, Thursday is Thanksgiving, and Friday is off as well. But we have found in our research, we have many people that go out of town and then come back, send their sons and daughters to school that Monday and Tuesday. And that's one of the things that we've learned is that we're trying to minimize the breaks and the kind of the vacations, if you will, people leaving the state and coming back or traveling around big groups of people. So with that right now, we've made the decision that Monday and Tuesday of Thanksgiving break is going to be remote learning for the entire district. So we know that will happen. As you go to the next slide, so just as a reminder, this is traditional school day, everyone's going to come back Monday through Friday. And that's, again, if the health and safety precautions, there will be in place on all buses, vans, all transportation, and then specifically in the schools as well. The alternating or flex schedule, there'll be an A week and a B week. The A week is going to be those students that will be in school with the last name A through L, but also if there's families that have maybe a last name that's different, that fits in the other side of the alphabet, we're going to keep families together. We know that that's critical for daycare. That's also critical for additional planning. So we are going to make sure that we do that. So that's week A through L. Week B would be M through Z. So the same would hold true. So for instance, if there's somebody in the household with the last name Adams and somebody in the household with the last name Marquise, then we're going to keep everybody together. Okay. So again, week A will come to school face to face, while week B is doing remote learning. Then we'll flip flop that second week B will be face to face and week A will be doing remote learning. So I hope that provides enough specificity for you regarding that. So let's go to the next slide, and we're going to go specifically into, we're going to go one more slide. Thank you very much. To talk specifically about remote learning. And this is when students receive direct instruction as well as assignments throughout the course of the day, and they do it remotely. So they're at home. They could perhaps be in a library. There's a lot of different places that remote learning can take place, but that's where it happens, and the teachers will provide that direct instruction. Now, it's going to look a couple different ways, mind you. So it could be the face-to-face interaction through Zoom. It could also be through different assignments with Google Classroom. It could be through videos on YouTube. This is the creativity that our teachers have exhibited throughout their career, but specifically when you look at the great work that was done the last 3 months of the school year with how to engage. So just trust us to have engaging lessons. We will have engaging lessons. It's going to look and feel different than the last 3 months. We're going to have consistency. We're going to have check-ins. There's going to be a lot going on. So just know that the remote learning will be engaging. There will be contact. There will still be levels of support when needed. So really making the decision, it has to be like this. I'm going to send my child back to school. And many parents, you've already heard, have concerns about COVID in general and how that may impact some of their loved ones that they perhaps take care of, or going to see mom or dad or grandma and grandpa. So we know making that decision may look different for each parent, and that's okay. But if you have concerns about that, trust us, we're going to do everything that we possibly can, safe and whatever, but we can't guarantee that COVID-19 is not going to be in our schools. We can't guarantee it. I'd be silly to do that, and you should run me out if I said that. We know that COVID-19 at some point is going to be in schools. And we're going to talk specifically about what that looks like to try to provide some security, but most importantly, specific information for you to be able to make this decision. So again, for remote learning, we just ask 1 semester commitment for sure, and the 1 semester commitment and the second slide coming with a full semester, it's the same thing. It's going to be through Google Classroom, and then we heard you loudly and clearly on the surveys that we sent out. What the information we receive back from students and parents, as well as teachers, the consistency of the platform matters. So we have Google Classroom that we're going to use. Now, it doesn't mean that within Google Classroom, we don't use other platforms to help drive instruction at the highest of all levels, to deliver content in an engaging way. So that may mean doing things a little bit differently. It could mean that there could be a link in Google Classroom to go to another wonderful educational platform. That could be something as, it could be going to YouTube. It could be going to Khan Academy. It could be going to, there's, again, so many different, if I start, I'll probably never stop. So just know that the main platform is going to go Google Classroom. Okay. Specifically now, when you look at what that looks like, again, daily instruction for students, direct daily instruction, but that's not going to be 6 hours. That I know for sure. We've had unbelievable collaboration and support from our teachers, from our support staff, our staff, and really, I say it all the time, and I should just say teachers in general, because every one of our staff members is a teacher. If you go walk in the hallways, I mean, it's just unbelievable the levels of support, and there's learning that goes on. So from now on, when I say teachers, just understand I'm talking about every employee in our district. So our teachers have done a great job, and we'll continue to do that. We've had great input from them. So whether or not it was with the reopening task force or specifically with different phone calls and different conversations and surveys that have been filled out, great support across the board with the surveys. And this is what we found, that everybody wants more engagement. Everybody wanted a specific platform. So we've chosen that. We're moving forward with that. People want to make sure that I don't want my child in front of a computer screen for 6-7 hours a day, or a telephone for 6-7 hours a day. And guess what? It's not healthy for anybody. So we know the best that we can is engaging lessons, making sure that we structure the day accordingly to provide for as much engagement and enrichment as possible. So again, virtual opportunities will be available to meet with classmates. That's something else we heard. But also, if you do remote learning, you could still participate in clubs and activities, sports, music, and so forth. So how that looks is going to be a little bit different, and we're working through some of those logistics. But basically, after school activities, so you're remote, and then you could come to participate in after school activities. During the day, you've made your choice to go remote. There's some other things that you may have to do to participate, but we'll have to work out some of those individual necessities later on. And then also you will have regular check-ins, and there'll be coaching that'll be available. There'll be personalized support. And I know I'm going to mention this later as well, but there's going to be opportunities for parents to learn a little bit more. We're going to have parent learning series to be able to help parents with technology and so forth. And some of the parents right now, you know that your sons and daughters, like in my case, know more than I do about some of the apps and so forth. But we're going to close that gap, parents. We're with you. We're going to close it. Chris Lockhart, our director of technology, has guaranteed it. Tricia Roddy has said, yes, that will happen. I'm going to hold them both accountable. So we're going to have a great learning series, and we're going to get it done. So let's go to the next slide. And again, these are the resources that we talked about. Again, we're going to have virtual and in-person opportunities for trainings, the Parent Educational Community Series. And from a student perspective, there will be assigned staff that will serve as a point of contact. And so we know that staff member will be assigned students, and that's going to be their job, the remote learning. So there will be constant contact for sure. So also, we don't want to forget, and it's really important when we talk about students, and you know what our mission statement is, we're talking about each student. So students that have been identified perhaps with IEP, 504 plan, or specific learning plans, behavior plans, so forth. All of that we've taken into account. So we do know that throughout the course of this year, that there's been a waiver at the state of Ohio, actually across the country, to allow for remote learning to happen for those students that have been identified with special needs. So that will happen. We will meet the goals of the IEP as best that we can. We know the goals are set forth in a collaborative fashion, and we will go after those very aggressively. Again, multiple contacts is what the goal is. We will do everything that we can to ensure that we're providing the necessary support that has been predetermined in an individualized education plan or a 504 plan and so forth. A WEP plan, which is our gifted plan as well. So just know that through the teams and all that, we're going to make those informed decisions. We will continue to meet as prescribed by the IEP, and we're going to do everything that we can. Know that things are different. We've asked for in the beginning of this whole process for flexibility. And again, the parents have been so flexible. But moving forward, we're going to ask for less flexibility than we asked for last spring, because we're getting really good at this, but we know we still need to get better. So we do ask for some flexibility and constant communication. If you're frustrated, if you have questions, if you need to talk, please make sure you reach out. And if via email, telephone, and so forth, make sure that you do your part in reaching out. All right. So some of the biggest and most important questions that many of our parents have had, our staff members have had, and our students. And I have to tell you, earlier today, I was at the school working out, and I noticed students coming in who were working out as well. They had masks on, temperatures that were being taken. We had 2 sanitizing stations that were set up in the weight room. The students, if they weren't wearing masks, and there was only one that I saw that was walking out of a car, and she was putting on her mask as she was walking up. But even in that case, she was socially distant from the students. So the coaches have done a great job. We're going to need that same support, and we will have that same support of all of our staff members during the course of the year. We're going to talk specifically about what we're going to do with masks here momentarily, but please know, and John Fricke, our Director of Operations, has done a great job. We have all kinds of PPE, personal protection equipment. We have all kinds that we have in our district now. We're on the forefront of ordering hand sanitizer, cleaning devices, and so forth. And Mr. Fricke may later talk specifically about some of those and what does it look like when we talk about deep cleaning. But again, just for some safety going in, we're going to follow all safety protocols. All staff members need to be fever and symptom free before coming to school. We're going to continue to work closely with Hamilton County and Springdale, as evidenced specifically on this call today. Again, Matt Clayton and Amy Ellis. And then also, if a person is exposed to someone who has been tested, they must quarantine for 14 days. And we'll talk more about that here coming up. We're going to get the experts talking about that. But let's talk specifically, and this is a couple slides, but talk specifically about safety, masks, and socially distance. So every single day, parents, every single day, you must take your son or daughter's temperature. That is a requirement. We need you to do that. We need you to help us, but also help the general health across this region, state, and country to make sure that you're checking temperatures every day. If they're symptom-free, no problem, then you could take them to, and fever-free, you could take them to, drop them off at school, or we're going to provide transportation. We're going to talk specifically about that now. To get on a school bus, your son or daughter must wear a mask. Cloth masks are the best, and we'll talk more about that. I'm sure that Amy and Matt will talk more about that here in a second. But also, we're requiring all students, grades 3 through 12, to wear masks when they enter school, on transportation, when they're in the hallways, and in the classrooms, with certain exceptions. So for instance, in a classroom, everyone's socially distanced and whatever, then mask, we will allow that. but more specific detail will be forthcoming on that. So let's move to the next slide. Again, there's nothing that trumps being socially distant from each other. Now, again, when I even say that, it makes me sad to think about, because sometimes when you think about socially distanced from a mental health perspective, that means that people aren't interacting. What we're specifically saying about that is socially distanced is at least 6 feet. Now, the American Pediatrics Association has come out and they said 3 to 6 feet is appropriate. You may hear the CDC next week talk about something a little bit different. I'm taking a pretty hard line on this. That 6 feet means 6 feet. If you're not going to have a mask on, that 6 feet is 6 feet. It's critical to make sure that we stop the spread and for us to have a really good year. Because let me give you one scenario, that if a student is not wearing a mask in the hallway, they are 100% symptom free, no fever, nothing. They stop, they talk to some friends and whatever. All of their friends are wearing masks. They see their friends in the hallway a little bit of time, then they go to class. Some of those friends are in class with that person. They're within 6 feet of that person and they're talking. They go to perhaps the cafeteria and they're sitting at a cafeteria table. If they are determined to be exposed in that scenario, what happens, there's many, many people that have been exposed. And that means 14 days of self-quarantine, 14 days. We need your help, parents, to make sure that your son or daughter is not coming to school with a fever. So that's going to be a requirement. Again, hallways are going to be one way. That's critical for the spread. We know that. Going 2 ways, definitely there's more exposure, perhaps more exposure. Masks are going to be mandatory during all transition time. Staff members will wear masks, face shields, and maintain 6 feet as much as possible. And then when socially distancing is difficult, we do know that masks are absolutely critical. And that's why we're saying masks are going to be required. Now, we do know also it's difficult to wear a mask. Right now, I've wore a mask in a couple of meetings I was in this morning. I'm happy to have my mask off, but I'm socially distant from everybody, more than 6 feet. And I do know I enjoy the break. I'm glad I'm not wearing the mask. We do know that kids are going to need that break. So we will have mask breaks built in, but it's going to have, the kids are going to have to be socially distant. So, well, let me go back 1 second. Okay, now I'm going to go back again. Thank you, Chris, for moving the slides along. One more, Chris, if you don't mind. So the biggest question that maybe people have is, what happens if my child is exposed to someone who tested positive for COVID-19? It's really simple. If determined, 14 days that they will be quarantined. So they'll automatically go directly to remote learning. So if your son or daughter is determined to have been exposed, 14 days they will be at home doing remote learning. This is why, again, it's critical that we have those 5 days at the beginning of the year. To added 5 days for our teachers, for prep time, whatever, because we're going to need to, boom, go directly into remote learning. Exposure is determined this way. 6 feet, you're within 6 feet with or without a mask on for 10 to 15 minutes. And that's cumulative time. That's why the example I gave you earlier is really germane to what we're saying right now. So you have 2 or 3 minute contact here, 2 or 3 minutes in another classroom, and so forth. That adds up really, really quickly. So it's my honor right now, and certainly appreciate all the help and support that Matt Clayton from the Springdale Health Department has given us. He's with Amy Ellis. And again, Amy, thank you so much for the communication that we had this morning. And again, just working together with Hamilton County is critical. So Matt, welcome. And I'm going to set you and Amy free to talk specifically about social distance, mask, and again, what it looks like if somebody is exposed, and just provide additional support. Matt?
Thank you for having us. It's a pleasure to be here, and we do appreciate the great working relationship that the Springdale Health Department and the Princeton City School District have. As always, as we're working through this pandemic, as these questions are coming up, having this opportunity to communicate directly with the district families is very much appreciated. I'd like to echo a few statements that you've made that I think are really relevant. The district's been very consistent about discussing the importance of social distancing. And I want to go to this example. Let's suppose that we have children in a classroom that are social distancing. We have a child who tests positive for COVID-19. The kids have been more than 6 feet away. They've been wearing masks. We're taking every protective measure we can. That's really going to limit the impact in terms of how many of those children would then have to self-quarantine or self-isolate at home. So as the district has stressed the importance of social distancing, we support that. We think that's a very wise position for the district to take. We know it's not going to be easy, but it certainly helps to protect the health of the students, and it certainly helps to make it such that as much as possible, the district can go back to a normal situation for school. The other aspect of the conversation today, the discussion of face masks, this has really become a hot topic, especially considering the information that's put out by the state this week, the mandate from the governor that everyone in Hamilton County wear a face mask when in public settings. This is also not easy to do, but it's just such a critical protective measure as we seek to limit the impact of COVID-19. So not only for our students who will be wearing masks as a means to prevent the community spread of COVID-19 and the critical impact that could have on the school year, but also for the families. If we can just encourage everyone to please wear a mask if you're physically able to do so. If we're all working together and we're all wearing masks, face coverings, face shields, we will literally watch this pandemic crash. It is something that we can do if we're all working together. Again, Superintendent Burton, thank you so much for having us today.
Thanks, Matt. You're quite welcome. And one of the things that I kind of want to put you on the spot, Matt, you and Amy, if you will. All right. So, what precautions can be taken by a parent to ensure that their son or daughter is never exposed to COVID? I know never is hard. That's really putting you on the spot. But to really kind of reduce the potential of being exposed.
Well, Tom, I want to speak from a personal perspective. I'm a father of 4 children. I have 4 children aged 8, 9, 10, and 11, 3 adopted children. The reality is that I have a daughter that we adopted from China who has a special medical condition. She's at risk. And so it's very important to me that I and my wife, our family, are doing everything we can to reduce the potential of my daughter incurring the virus. So I'm going to ask the district families to consider this as an example. When I'm out, and this has been my protocol since March, if I'm out in a public space, I wear a mask. Now, there's been some discussions about what's effective with masks. Certainly N95 masks are effective, but even a cloth mask is very effective in stopping the transmission or the risk associated with COVID-19. It is because it's going to stop the respiratory droplet transmission. It's going to protect the public, and it's going to protect me. Social distancing is critical, maybe even more important than wearing a mask. And another critical aspect is hand hygiene, hand washing, and the effective use of hand antiseptics, or as we commonly know them, hand sanitizers. The district has been, there's a high level of confidence at the Springdale Health Department, and if I may speak for also Hamilton County Health with Princeton City School Districts. It's because we've seen in the past that Princeton has been so proactive and they've been so effective in their measures to protect the health and the safety of our students. Princeton has taken it upon themselves to seek out proper protective equipment, personal protective equipment, or the PPE, and they've also put in place some very effective measures for environmental disinfection. If I think about the things that Princeton proposes to do to keep the kids safe while at school, the use of face coverings, the use of good procedures for hand sanitization, the use of social distancing, and a heavy emphasis on environmental disinfection or cleaning of the classrooms, those are critical steps. and they're going to pay off for us in really protecting our students and keeping them safe.
Thanks, Matt. And this is almost as if you've seen this entire presentation. Now, Matt didn't see the entire presentation. That was the goal. But our very next slide, if you look right here, actually talks specifically about cleaning and sanitizing, what that kind of looks like and what we plan on doing. And again, we're going to do everything that we possibly can, but we know we're going to have frequent cleaning of high-touch surface areas, multiple cleanings of restrooms throughout the school day, deep cleaning of the building each evening, additional cleaning on weekends as needed. We do know that we have people coming in and out. Hopefully, sports season is going to go off, no issues at all, but we're going to have other people coming in and out of our buildings. So we know that's going to require additional cleaning. Opportunities to provide hand washing throughout the course of the day, that's going to look and feel different for sure. Having hand sanitizers in each classroom so that when you go in there, you make sure that you put some on your hand. But there's nothing that replaces, and I know Matt's probably going to smile on this, nothing that replaces proper hand washing techniques. That's certainly what we've been told, right, Matt?
That's absolutely true, Superintendent Burton, 100% true. Hand washing is critical. The use of hand antiseptic hand sanitizers, where hand washing is not an option, but we cannot beat good old-fashioned hand washing. According to the Centers for Disease Control and Prevention, effective hand washing is the single most effective way to reduce the spread of communicable disease, including COVID-19.
Thanks, Matt. And again, so in big high traffic areas, there's going to be hand sanitizers that will be available throughout the course of any of those areas, but also in each classroom. And so with that, actually, there's a big cost to that. And with masks and shields for there's so much that's required. And thanks, Matt, again, actually Springdale Health donated 5,000 face masks for our staff to use. And again, if you wear a mask like I am right now, if you wear this mask needs to be changed. It's not to be worn day after day after day. So that's going to require our staff to wear a lot of masks through the course of the year. If they're not wearing their own cloth mask, but if they wear their own cloth masks, they shouldn't wear it day after day after day. They need to change those out. So we do know that there's a big cost to that. And Matt, thank you so much for helping us with that. Matt also was liaison to Hamilton County as well, connected myself and some others in an email to make sure that Hamilton County, if they get a whole bunch, send some our way as well. And if there's anybody on this call that has any connections or from a donation perspective with hand sanitizer, face masks, any PPE, we definitely would take that graciously and thank you right now for even considering it. So if we go to the next slide, we're going to go a little bit deeper, and I'm going to introduce right now John Fricke, our Director of Operations. And Mr. Fricke, if you can, just talk a little bit about the process. What does deep cleaning look like? And then stay with us as we talk about transportation as well. Mr. Fricke?
Hi, thank you, Mr. Burton. So as you mentioned earlier on the previous slide, we're going to be performing deep cleaning and sanitizing in all our facilities daily, including all the high-touch areas. We'll be hitting bathrooms and other high-touch areas throughout the day as needed. We'll be following all the CDC guidelines, and we'll continue to work closely with our local health department to make sure we're doing everything we can to keep our staff and students as safe as possible. We've also purchased some additional equipment, Clorox 360 machines that will help us in the evenings to do that thorough deep cleaning as fast as we can, as effectively as we can, to keep the classroom clean so that we're ready to bring back our staff and students.
Now, Mr. Fricke, if I can, just quickly, I apologize for interrupting, but I just learned this. So Todd Kutel, who's our Director of Buildings and Grounds, he told me about how this 360 cleaning device works. I've seen it on video, but it's a little bit out of Ghostbusters, I think, if you like that video. And it surrounds the whole, there's a negative and positive ions, I believe, that go. The science teachers out there are probably like, thank goodness you weren't teaching science. But it kind of surrounds the whole environment and goes even underneath. And so it's attracted underneath. So it is complete 100% sanitation. And as long as we we use it as it's prescribed, we're going to be in great shape. We're going to have 2, once we get them all in, we'll have 2 to each building. And some of our buildings are bigger than others. And if we have any need for additional ones, we're going to get additional ones. We will have that. And that's what deep cleaning is. So thanks, Mr. Frickin. Do you want to add anything else about deep cleaning?
No, sure. No, sir. I think we covered it all.
All right. So transportation, stay on the line here, Mr. Fricke. So Mr. Fricke is our liaison between us and the service provider for transportation, First Student. And I know Mr. Fricke's been talking to First Student for months and months and months, specifically about like, what is it going to look like for transporting children? And we've been waiting for guidance and so forth. So what we know right now are masks are going to be mandatory to get on buses. The capacity, while the capacity depends on Ohio Department of Education guidance, we do know, we believe 2 to a seat. Now, again, we're going to have assigned seats. And if there's 2 on a family that get on the same bus, they will be sitting next to each other. Again, we're not trying to have multiple kids, students like getting on a bus and sitting wherever they want. Those 100% will not happen. And again, not being mean about it or whatever, but we have to do every single thing that we have to provide safety and security. If students are not sitting where they should be, there's not going to be tolerance for that. It's too serious, and they'll be warned, and we may take the necessary action to say you're no longer allowed to use transportation. So moms and dads who are listening to this, guardians, uncles, grandparents, and so forth, make sure you let your son or daughter know that when they get on the bus, there is no playing around. There should have never been playing around, but now anything at all, like getting up and moving and all that stuff will not happen. It can't happen. It's too serious, and we have to do everything we can to avoid any type of spread with COVID. All the rules and policies and procedures are going to take place. But Mr. Fricke, anything on transportation, anything that you've talked to with a great partner that we have with First Student?
We're just currently working through all the details, trying to make sure that we have the capacity to get students there on time and get them there safely. So we have another meeting scheduled on Monday to go through some additional information. We're going to make sure the mask are worn and the seating charts are available and the kids are sitting where they need to sit, and we're keeping them as safe as possible. But we're just still waiting on some more details, and we'll be working through those as we get them.
Thank you very much. We're going to go to the next slide, and I'm going to just hit this very, very quickly. And this is just communications in general, how we're going to continue to provide communication to our parents. Website, social media, letters. We are doing some kind of snail mail, they call that, but push that out, as well as emails, videos, Facebook Live events like this one, robocalls. Everybody on this call should have been receiving all calls from our district. If you have never received one, please make sure you call that hotline number again at 513-864-1162 and give us all of your contact information. If you've never received one, we will make sure that we get you on that list right away for sure. We're also going to have educational series for parents and community, the hotline number, as I mentioned, and also posters and signage and health and safety security, as well as, if we go to the next slide, our website, Facebook, Twitter, Instagram, Welcome Center number, again, that's there, and our hotline, lastly. And then we have our Board of Education meetings. We have one coming up. These are virtual meetings again, and you could get that on Facebook Live. And if you just type in Princeton City School District on your Facebook search, you should get ours, but also specifically at PCSD Viking. And then if we go to the next slide, one thing that we definitely don't ever want to forget, and these are some additional information about educational series, but if you go to the next slide, and this is something that very deliberately looking at this is absolutely critical. We know that many parents wanted to know some of the specificity, but when we look specifically at providing the social emotional learning, as well as the mental health supports, we have great partners. And so let's take a look at a couple of those. And I'm going to bring on Dr. Mary Phillips, who's our Associate Superintendent right now. And Dr. Phillips, I may throw some softball questions at you right now, but I know you've been doing this for a couple of years, and you've been so instrumental in bringing some great partners to our district. So can you just highlight just a couple in those areas?
I sure can. I also need to share that Dr. Jameson, who is our Student Services Director, has brought on a number of those services as well.
Done a great job.
But basically, when you look at the slide, you see that the Talbert House, the Lighthouse Youth Services, the Children's Home, many of these agencies have already been in our buildings and have developed relationships with our staff, and also have actually clients that they see on a daily basis. So those individual agencies are going to continue to work with our families and our students. Camelot Community Care is another one as well. Then we also have the activities that we have in our buildings, which is the Hope Squad, which we've done a really great job with training many of our students to act as peers to support some of our students. So those types of services will continue to be offered as well. And then obviously we continue to get trained through Xavier University and Hamilton County Educational Service Center. One of the things that we are going to make sure that we do is we have counselors in our building that will provide some additional supports as well. At the elementary level, we actually have provided added on a couple of new counselors to be able to work with our students around social emotional learning. This could be done through activities, face-to-face activities, as well as the remote activities. So we're really looking forward to making sure that we support our students in all aspects so that they can continue to be successful as they move forward with their education.
Thank you, Dr. Phillips. Thank you very, very much. And, you know, I think one thing that Dr. Phillips talked about, which I think is very, very critical, is the fact that a lot of these services have been in place, but we've been responsive to what we have seen, not only in the interaction with students, and we've gotten reports from teachers and other staff members that we need to consistently have that contact, that connection, and making sure that we're providing mental health supports when needed, as well as continuing all of the great support that we have in different activities. So if we look to the next slide, if we look at the next slide, those are specific. So when we talk about mental health services, as Dr. Phillips talked about, right there on the left-hand side, you see what that looks like. So individual and group therapy, case management. So even if you choose the remote learning option, those are still going to be available. The same for social emotional learning opportunities, as well as PBIS. Now it's going to look and feel different. It has to, it's remote. And again, from the very, very beginning, when I did this first video about moving into this remote learning atmosphere, nothing replaces the whole face-to-face. But we're going to do our very, very best to have it be as authentic as possible. We do know that the most powerful educational learning engine we have, I believe, is a face-to-face interaction with teachers, because it's all encompassing of the whole child. But if you want to know something, and you want to know something quick, and you Google something, you're going to be able to get information. But just getting that information is never enough. We need to extend learning at the highest levels. And we know that sometimes that puts some pressure and may cause some anxiety. So if you choose a remote learning option and you feel your son or daughter is having some specific need that we can help with, make sure you reach out right away. The earlier, the better. Early intervention always is helpful. Dr. Phillips, you wanted to add something?
No, I think you've pretty much dealt with it. Those are the services that definitely will be provided. One of the things that I needed to share, Mr. Burton, is there will be mental health services as well. And so those are services that would be provided through telephone, video conferences, et cetera. So, and all of our mental health clients, all of our mental health partners have that process available, and that's those services available to all of our families.
Okay. Thank you so much, Dr. Phillips. And there's a big team that put this together. Tanya West Wright, who's our Executive Director of Pre-K 12 Curriculum, Teresa Warren, our Director of Special Education, Chris Lockhart, our Director of Technology, Trisha Roddy, Director of Communications, Dr. Mary Phillips, of course, our Associate Superintendent. We've had many other people that helped support Dr. Kevin Jameson. The list goes literally on and on and on. So certainly appreciate everybody. And the last slide is any questions. So what's been happening behind the scenes, just to let you know, is Trisha Roddy has taken a look at all the questions that people have asked. She's updating our frequently asked questions because every question is critical. So our frequently asked questions, she's been updating. So I'm going to put everybody on pause just for 1 second while I grab a computer to take a look at some of the additional questions that need further elaboration. So welcome back. And this is our frequently asked questions session. Great questions, by the way. I've seen them pop up on the computer screen that I had set up outside so I could take a look at some things as well. But will every school have a full-time nurse? Every single school will have a full-time medical provider. So what that looks like is some schools will have an official school nurse. Some will have a health aide, a health specialist, and I'm actually, everybody who is employed will have a license of some sort. So Dr. Phillips, can you elaborate on that, please?
Yes, we have done a great job in looking at the services that we need, the medical services that we need to really support our students. And so what we've done is we've made sure that in each of our buildings, there is going to be a health professional. In the past, we've had nurses who have traveled from one building to another, maybe 2 days in one building and 3 days in another. We know because of the seriousness of this pandemic that we want to make sure that we have health professionals on staff daily. And so that will definitely occur. Mr. Burton.
Thank you, Dr. Phillips. Yeah, it's really, really important to understand that by adding, and we've added, but by adding, we are ensuring that we will have a health professional in each building. So thank you for elaborating on that, Dr. Phillips. And I just want to reiterate, we know exactly what we're doing in terms of moving back. We're going to go traditional unless all the remote survey, all the survey and all that stuff suggests that we can't provide safeguards. So we know exactly that we're going to come back traditional, assuming that we can provide social distance, assuming that we can do it very safely. If not, we're still going to come back face to face. The only difference is that we're going to do alternating schedules. So I hope that provides some specificity there, but that's all relevant when you look at from a healthcare profession, because some of you may say, if we don't have a school nurse or a health professional in each building, I don't want to send my son or daughter there. But rest assured, we will full-time in each building throughout the course of each day. Another question that came up, do kids have to wear masks on bus if they are under 10 years old? The answer to that is yes. Now, we do know from a developmental perspective, it becomes much more difficult, but we are requiring that on the bus. So we do know there may be some things that'll happen. We're going to have to maybe provide some additional support, but we're going to do that. I would say that if your son or daughter, one of them may be under 10, another one may be over 10, in third grade perhaps, and they're riding with a first grader, that they certainly can help and support if the masks fall off and so forth. Another question is, will students be denied getting on bus if no mask? Parents, not being hard on this, but we really need your help and support. This is July 9th. School is not going to start until the third week of August. And we have a lot of time to be able to find masks, to make masks, and so forth. However, if something were to happen and they were to get on if their mask falls off when they're walking to the bus, it becomes dirty, they become uncomfortable, we will be able to do that, but we cannot do that every day. Mr. Fricke and I were talking about this, and I'm going to be a little bit dramatic here, but I want you to think about this. We can't provide masks for each student every single day. We would provide, just in 100 school days, we would provide 6.5 million masks. We can't do that. We need your help to provide your own mask for your son or daughter. Now, it's really masks. It's a couple masks because they'll need to change them out each day. And so in that respect, we may, in different perspectives or different situations, I should say, we'll be providing masks, but it will be a rarity. When we look at what other kinds of masks teachers will be wearing, we do have the face shields. As you mentioned, we did buy a lot of those. Every teacher, staff member will be provided a face shield to do that. We do know that that is safer than wearing a mask. It's proven. Wearing a mask and a face shield is safer yet. So that's what we're doing in that respect. This is, what if families with children under 10 old want them to wear masks? By all means, you could wear the masks, no problem. Remote learning will not be pass-fail. Great question. We make sure we add that everywhere. Remote learning will be graded, and everything that we'll take into account in that. So if you may take an honors class or an IB class or whatever, while difficult, we have to make that happen. This is an option we're making happen across the board. So all grading and requisite weight of classes will take effect remote as well. If someone in the class has a positive result, will the school shut down for 2 weeks? And let me add this too. Or will everyone in that class have to get tested? Will they have to quarantine before returning to school? Phenomenal series of questions. So first, if someone in a class tests positive, will the school be shut down? Maybe. And here's the situation. We have to go back to look where that student was, if they had contact, how many students were they in contact with? Was it actually exposure or just a little contact? So again, when you look at that, Matt, I'm gonna pull on you if you don't mind. I see you're still here with us. Thank you. Matt, just go one more time. What that looks like, exposure, what that looks like. Matt?
Superintendent Burton, thank you for calling on me to speak to this. This is a great question. Talking about exposure, this goes back to the wisdom of what was being presented earlier by Princeton City Schools, the emphasis on social distancing. Let's suppose that we have a student who tests positive for COVID-19. And I think we all know that over the course of the school year, this is not a question of if, it's a question of when. This is going to happen. The key is social distancing. If we have students who have been within 6 feet of that other student for more than 15 minutes, they're considered as close contacts. If they're close contacts, they're going to have to be at home self-quarantining for 14 days. That's, of course, uncomfortable for the students, and it puts an undue strain on the families. So if we can follow these great protective measures that have been put forward by the district, focusing on the use of a face covering or of a mask, focusing on the absolute need to social distance 6 feet or more, focusing on hand washing, hand hygiene, environmental disinfection, and for families to keep the kids home when they're sick, we can avoid what I think could be disastrous consequences for the families.
Thanks, Matt. And I just want to reiterate one more time that if it's determined that there is, that a child has been exposed to someone who's tested positive for COVID, this is what happens. Now, it's a little convoluted. So in this case, you're going to quarantine for 14 days. But how it happens, and I'm sorry I didn't talk about this earlier in greater detail, but how it happens is when the contact tracers from a health department, when that child says, if a child on Monday could be fever-free, symptom-free, Tuesday, fever-free, symptom-free, but at night, start having symptoms. That is when you go back 48 hours. That's when you determine anybody that needs a quarantine. So it's going to be a big task, but we're up for it. And we'll work with not only Springdale, but Hamilton County, and we'll work with that. But there's going to be times when there will maybe be one classroom and maybe a couple other students outside of classroom that's going to have to quarantine for 14 days. And perhaps even the teacher will have to quarantine for 14 days. There are major ramifications, which is why we're being so hard on taking every single precaution to avoid us having to do this massive closure. So again, great question. And students that are quarantined, it has to be 14 days from when they were exposed. So in the example I just gave you, Monday a class was exposed. Tuesday, the child symptomatic. All those kids are still in school. Wednesday, all those kids are still in school because the child hadn't even been tested yet. The test happens on Wednesday. Friday, we find out that that child has a positive COVID-19 diagnosis. We go to Monday, because that was the last exposure date, and it's 14 days from that date. Now, I know it may have been a little bit confusing and certainly don't want to do this. Many of those we're going to be able to specifically give examples, and we'll provide additional information on our website, and we'll actually give a specific scenario on that. And I know right now someone's probably working on it on this call when they heard me say it. We have such a great team, but a specific scenario of what it looks like. And again, exposure from the first, so I'm sitting next to somebody who has COVID, looks very different than maybe my brother or sisters who sat next to somebody who has COVID-19. So we'll provide as much specificity as we can down the line. So let's look at a couple other questions very quickly. We're getting toward the end, so thank you. So currently, someone asked if they make a decision right now on the survey, is it permanent? If you choose that you're going to go semester or year long, we may give you another opportunity if guidance changes, but right now it's critical we get it. For the people who have not yet filled out the survey or who don't do it by July 14th, we're going to be calling you. We have to get a hold of everybody. People have to make that decision so that we're able to make an informed decision moving forward. If we do not take the time, I mean, we can't have people the last second say we're not going to do remote learning anymore after we've made all these plans. It's a major work to do what we're doing. The sooner we get the information, the better the transition to the regular school year will be. That is why we, instead of saying a full year commitment, that's why we did a semester commitment. Do a semester commitment. If you have any questions, I would do a semester commitment. Later on, do a semester commitment by July 14th. And for those that are really uncertain, then, the longer you wait, the worse position you're putting us in. And I know you may need additional information. We're to give you additional time. But ultimately, when that phone call happens, that is going to be final, and that's it. Because we can't make decisions after August starts. We cannot do it. So that's where we know that. Lunch questions, how would this look like? In different buildings, it's going to look different. So we know that in elementary schools, eating in the classrooms is something that we can do, we can make happen. Middle school, high school, that's going to look very, very different. We're still working on some additional plans on that. But again, this is why it's critical to fill out the surveys. Hypothetically speaking, if we had 25% of the high school that chose remote learning, then we know right now with the way we're going to have to, if we have 4 lunch for lunches like we did before, we're going to have about 150 less kids in each of those lunch periods. That's critical for us. That's different. We can do that. We could socially distant. We know that we can make that happen. But if nobody chooses remote learning in the high school, we're going to have to, I don't even know how we're going to be able to do it. Quite frankly, I'm being honest with you. I know that Ron Ballmer has looked at the high school principal, talked with Don Stollard, associate principal, and a great administrative team he has with grade level principals, guidance counselors. He's pulling everybody, trying to think differently outside the box, what lunch can look like. But it can't possibly look different because we can't get 2,000 lunches in the different classrooms because it's a different learning environment. And the middle school, under leadership of Dr. Dave Maxim, the same thing. We have to look really creatively. That's why this survey is so critical. That's why we need it early on. And that's why we've had this Facebook Live event and another one tonight as well. So what grades does remote learning serve? That's kindergarten through 12th grade. We know that the younger it goes, the more complicated it is. But again, there's going to be opportunities, but it does not serve preschool. There's no remote learning for preschool, but it is K-12, and we've had many people ask about that. So can I make my decision once I know what the school year will look like? Hopefully right now you do know what the school year is going to look like in regards to we're coming back, we're going to provide transportation. However, based upon the survey, we may still have the flexible week. And for some that may seem ambiguous, but I hope you understand that we have to have those numbers. But right now, as numbers come in, we are getting very, very confident of being able to come back in traditional setting every single day. But without some of that information, for instance, if nobody chose remote learning, we would have to do the flexible week schedule, week A, week B, if nobody chose remote learning. But we do know that people are choosing remote learning. So as we continue to get more information in, we do know what's going to happen. So I hope that provides you with specifics enough to be able to make a decision right now. But still, some may want to wait to see what's going to happen if there's going to be additional information coming out from CDC, American Pediatric Society, from perhaps different physicians and so forth. So we do know that we're providing for Wi-Fi for students that need it. We have been very diligent in our pursuit to do that over the course of the pandemic. We've had it available throughout the community. Anybody who has asked for it, I think, well, let me not say everybody, the vast majority of the people that have asked for that have received it. We've worked with Cincinnati Bell to get a really, really good rate to be able to provide for teachers. The Board of Education has been unbelievably supportive of this. We will provide Wi-Fi for those that need it. Now, there's going to be a little bit of a process to get it, but we will provide Wi-Fi for that. Now, some of you may get a portable Wi-Fi device, a Wi-Fi device. It may look about like this big. Sorry, like this big, if you will, part of my phone. And that Wi-Fi, you'll be able to take that unit into your house, into your apartment, so forth. And then you'll be able to have everybody in your family on that. But just know that all school rules apply on that Wi-Fi. All school rules do. We could shut it down at any point if there's any inappropriate use. Not that there would be, but I have to say that. For others, if it's one student, we may provide Wi-Fi through Cincinnati Bell. Now that, because of how they set it up, that's not going to be the same level of support as the Wi-Fi. But Cincinnati Bell is about half of as expensive as the other Wi-Fi. You'll still be able to do Zoom calls, still be able to get on internet and so forth. So we will make that determination as the year gets closer, but we have great information right now of who needs Wi-Fi and who doesn't. And I think we're about 100%. But again, if you need Wi-Fi and you don't have it and you're concerned about it, call that hotline number. Again, 513-864-1162. So somebody asked about the program costs. You've seen other school districts, and Rightfully so, some other school districts have chosen additional platforms and they've charged for going remote learning. We are not. There's zero cost for that. We are assuming every single cost. We believe that is critical that we provide education as is close to what we do face-to-face in a remote setting. So that is free of cost. Will I lose my neighborhood school slot in the future if I chose remote learning? No, you will not. That's it. You will not. Can my child return to brick and mortar school if conditions approve? Yes, at the semester, not at any other time. You for sure will commit for at least a semester. If you commit for the year, you commit for the year. The flip-flop and back and forth, that from a scheduling perspective, and this is what I know, while everybody would say that they're going to be very flexible, no problem, Mr. Burton. I understand you need time if I choose my son or daughter to go back. But what will happen is people lose patience if it doesn't happen fast enough for their liking. That is why it's a year commitment, you're in for the year, or it's a semester and you're in for the semester. We've already answered some of these other questions that I'm looking at. I'm looking specifically now, what about special education? Can a student with an IEP or 504 plan attend the virtual program? Absolutely, yes. We will work through that. Will Chromebooks, how did my child get a Chromebook and other supplies? So remember, we're going one-to-one device, 1-to-1 for anybody in grades 9 through 12. Every 9 through 12th grader is getting a Chromebook. If you're an 8th grader and you take a 9th grade class, you will get a Chromebook as well. So that is for sure. For those students that choose a remote learning option, if you need a device, we're going to work through that with you. I'm just rifling through here. I'm sorry. Every student, full-time nurse. There's a lot of teacher questions in here. We're going to answer that again when we work through with some of the teachers. What are parents who work supposed to do if we have to go remote learning across the board, or if there's quarantine or whatever? I tell you, I feel for you, which is why any decision that we make, that's such a major component of it. It's making sure that parents can work. We know that is critical. If we go remote, I hate to say it like this, but you're gonna have to be flexible and try to do everything that you can. We are really trying to do absolutely everything that we can to eliminate that. That's why following all of our safety protocols are absolutely critical. So I probably can't give you what you want on that one, but if we go remote, we go remote. If there's a quarantine, there's a quarantine. There's nothing more we could do about it except for provide engaging lessons, contact with students, and try to help the best that we can. There will be enforcement of our rules and policies and procedures. There will be. So will someone be enforcing all these rules, masks, social distancing, etc.? Absolutely, we're going to have to, the very, very best that we can. We know that kids with masks on, if they're right next to each other talking, they can do that. They can do that. Both have masks, they can do that. As it becomes closer to that 10 or 15 minute mark, that's where it becomes more dangerous. That's why we're going to have people getting in there and saying, all right, kids, break it up, get to class, as we always have done anyway. But that's why it's going to be critical getting to and from classes and having social distance. That's going to limit the exposure rate. And we just a couple other questions. Of drinking fountains, what are we going to do with drinking fountains? We're going to sanitize those and so forth. We are going to say bringing water to school, your own water, not sharing that water bottle and all that stuff. You're going to be able to do that. We have to make that happen. Again, all school rules apply. We don't want people being silly, doing things that they shouldn't do, but you can send your son or daughter with water to school. That will be happening. We do know that is out there. That's a recommendation that happens from CDC, from different health departments and so forth. Please reinforce no sharing. If my child has to miss 14 days or those excused days, those are actually going to be learning days. So if your son or daughter is quarantined, they will still have learning happen. They will go directly in the remote learning aspect. And so there's no need to have it be excused because they're going to be working. And if they become sick during that time and unable to work, then that certainly would become an excused absence. And again, right now we're waiting for some additional information from the remote learning to be able to say we're going to go the flexible week, A week, B week, or the 100%, but we're getting closer and closer to be able to say we're going to go back 100%. And again, I'm looking at the vast majority of these questions. One of the questions says, why is the school not taking temperatures? Do we really trust parents to all do that? I just want to let you know that if we have 1,400 kids coming into the middle school or 1,600 kids coming in the high school, taking temperatures, socially distant, doing all of that in a manner where it's not going to cause major line up to actually get into school and whatever. I'm saying, yes, we have to trust parents. The CDC, the health departments, from the state, all throughout the nation, and all the local ones are saying, yes, parents, we need to do that. Now, if coming to school, if there's any concerns or questions that people have on it, or if a student comes in and says, listen, my mom, dad, guardian, whatever, didn't get a chance to take my temperature, then we'll certainly do that. But as of right now, unless something changes, we do need all the parents to do it. We have to have that parental support. And I'm going to be hard on this and really hard. And I'm going to be unapologetic. Are we really asking too much? This is a major societal issue right now. It's not asking too much that between now and when we come back to school, which is about 6 weeks, to be able to get a thermometer, to be able to learn how to do that, and get proper face coverings. It's not too much to ask. And so, yeah, I'm pretty hard on that. We are going to require, and we need to trust parents to do their job. But on the other hand, I don't blame you for asking that question, because that is a question too, that we have to have parents that are going to be able to take the temperature. And when you look at that and it's 100.5 or 100, keep your child home. And we'll get more guidance on that as we learn more about who's remote and who's coming back. A very good question. And again, there's so many questions here. And I'm going to go to the last page. Can people amend their survey if they've already submitted it and want to change it? Yes, you have until July 14th. Will remote learning be able to participate in art classes and band classes? Any child that chooses remote learning, that has a schedule, we will make that happen. Now, if you are a teacher on this call, on this Zoom, and you heard that, and you're an art teacher or a music teacher, and you're like, I have no idea how I'm going to do that, we are going to make it happen. That is why we're going to have another Zoom call for all teachers, staff members, everybody kind of coming together to talk about all kinds of different scenarios. But if we have to hire somebody to make it happen, we're going to hire somebody to make it happen. That's just it. Because ultimately, in these crazy times, we do know that we're going to do whatever we can to do what? And some of you might be mouthing it right now, to empower each student for college, career, and life success. And we can't do that if we forego the whole child. This is about the whole child. It's about still offering exploratory opportunities. And in some cases, electives may be offered online anyway, which would be great if we can do it. But I know that there's nothing that's going to replace the art teacher who walks past a student who sees that the shadowing may look different or could look different, and actually help with them. And they talk about the pressure of a pencil and what that looks like. There's nothing that can replace that. Nothing that can replace the music teacher who talks about maybe an octave different and they can hear it because it's in person. or playing a trumpet, what that looks like, or sliding with a trombone. And I think that's all I know, so I'm going to stop right there. But ultimately, there's nothing that can replace that. Anyway, thank you for being patient and joining us for that hour and 18-minute video. We hope that many of your questions were answered, but we know that some other questions came in, so I wanted to address those. And once again, the very first thing to do after this Facebook event is over, if you still had some unanswered questions, please make sure you go to frequently asked questions, section on our website. Again, can be found at www.princetonschools.net. And if you go there, if that answer is still not there, or the question is still not there, and you have some other concerns, please feel free once again to reach out to us, and we'll be assured to answer your question as best that we possibly can. So let's get right to some of the questions. So first one is, what happens if school goes back 100% of the time, traditional, and the parent or student is still not comfortable? So right now, the determination is getting closer, as I mentioned in the video, closer and closer to going back 100%. However, if at any time you would like to go to remote, we're not going to stand in the way. All I'm going to ask you to do, and again, if at any point you become uncomfortable with the precautions and all that stuff that we're taking, you have family situations that may change, and you may become a caregiver for someone that may have underlying health conditions, there is no problem. You will be able to go remote at any time. However, the inverse is not true. Remember, we need a semester commitment. That's what we need. Now, understand that if you go traditional to remote, we may need a little bit of time to put some, specifics together to make sure that that's as smooth as possible, but you will be able to go remote. Now, the earlier you make that decision to go remote, the better it is for everybody involved. We need to make sure that we provide specific guidelines, instructions to make this remote learning as practical as possible, as well as making sure, and most importantly, that it's as engaging as possible for each student that we serve. There always seems to be some questions regarding school calendar, and I could really go deep on this, but just know we considered many different options prior to making the decision we made, including when to start, before Labor Day, during Labor Day, after Labor Day. Well, actually not during Labor Day, but after Labor Day for sure. So we considered all of those options. When we look specifically at face-to-face instruction and how much students will get with remote learning, as I mentioned before, we know that it's not going to be 6 hours in front of a computer screen. So some of that will be determined specifically by the teachers as they deliver great instruction. The remote learning will have direct instruction every single day. How that looks is going to be predetermined by the great work that the teachers are going to do when they put together instruction and the classroom environment that they're going to make sure that they have as engaging as possible. So let me just kind of slow down and just say this, that every single day, students that are in a remote environment will have direct instruction. They're going to have independent work. They're going to be able to work with some of their classmates in a collaborative environment. That is what we know for sure, that will happen. So if you need a specific time amount, I can't honestly give you that right now, because we are still putting together what that's going to look like from a remote perspective to have the most engaging classroom that we possibly can have. But just know that every single student that's in a remote learning environment will have direct instruction every single day. They will be able to work collaboratively with other classmates that are also in the remote environment. We will have check-ins from a social emotional perspective. We will provide tutoring if need be. We are going to have this as engaging as possible for each student that chooses remote learning. A parent asked, and I think this is a very, very fair question. I need a final answer before fully committing to learning option. I'm okay with 50-50 learning, but not full 5 days a week with full class sizes. I totally understand that. So if we had to know right this second, I would just say to you, well, then you can't choose traditional coming back, because right now we're going to come back. And as we continue to trend to more and more students choosing the remote learning option, we're going to have the traditional school setting. All safety precautions, everything being taken in place. But again, if you're not comfortable with that, then you're going to have to choose remote learning. What happens if the semester is over? We're still not comfortable with kids returning to school. Will we have the option for kids to continue online learning? Absolutely, 100%. That option will remain. And also it'll remain if you choose traditional, and then, you know, who knows what's going to happen with the pandemic, but you become a little bit more concerned and you're like, well, I'd rather do maybe 50-50, but we're not doing that. Can I choose remote learning at the end of the semester? Absolutely. Technology capabilities. In the spring, we reached out, we did surveys, we made phone calls, we reached out, we actually did our own analysis when we looked at who was logging into our Google Classrooms, what we could do. We provided Wi-Fi across the community. We did a lot, and we still are going to do that. In fact, just tonight, I received an email from one of the Cincinnati Bell representatives who we've been working with very closely. So he sent some additional information. We will be putting out a lot of information here, especially once we find out the remote learning, who chooses that. But if parents, any parent on this Facebook Live event or that you know of, or anybody watching this later on, all you have to do is call our hotline, 513-864-1162. Give us the details and we will do everything we can to make sure we get you Wi-Fi over the summer. And then as we transition into the school year, we are saying as Princeton City Schools, anybody that needs Wi-Fi will have Wi-Fi, anybody. Now there's going to be some questions that you're going to have to answer, but not a ton of hoops to jump through, but we're going to need to ask some questions and we're going to do whatever we can. And again, I kind of mentioned that in the video before, so hopefully you saw that. Another great question was what's happening with Scarlet Oak students. Last night, they released kind of their plan, and let me just read directly from their website. Great Oaks will start the year with an A-B schedule. Students will be divided into 2 groups, with the A group on campus Monday and Thursday, and the B group on campus Tuesday and Friday, with Wednesday as remote learning, remote assistance day for all. Half of our juniors and half of our students will be on campus at a time. With this schedule, lessons will be designated to maximize the amount of hands-on work that students have in their career lab while on campus. So that is Great Oaks, and I would encourage you, any parents that need additional information, to go to their website or reach out to the great staff that's available at Scarlet Oaks. They do a wonderful job. Are children allowed to wear whatever mask they choose? That answer is no. If it's offensive, you're not allowed to wear it. If it's going to be substantially disruptive, you're not allowed to wear it. However, in terms of student creativity and so forth, as long as it's not abusive, something that we could see as disrespectful, something that could be something that we see that could be substantially disruptive to the school day. Other than that, yes, absolutely. And we've seen some very creative masks out, and it gives students some ownership to it. You know, one of the other questions that came out was about us requiring parents to wash the masks every day. And one of the things I mentioned earlier in the video was about having multiple masks. And again, kind of putting it right out there, you have plenty of time between now and August 20th when school starts to get several different masks. Now, also, as I mentioned, if something happens as students are walking to the bus, if something happens during the school day, if a mask breaks or so forth, we'll be able to provide those masks for certain. But by and large, we are saying 100% it is a parent's responsibility to provide a mask and a cloth mask specifically for their son or daughter to come on campus. And then will remote students have project-based learning and opportunities to learn outside in nature? So I'm going to answer this 2 ways. Will remote students have project-based learning and opportunities? Yes. And then specifically based on The lessons, again, the great engaging lessons that our teachers will create. Will they have an opportunity to get outside and do some things? I'm going to take a stab. I'm going to say yes. Our teachers do a wonderful job. They provide engaging lessons and will continue to do so, whether in person or online. And again, just one more time to reiterate, that's why it's really important for us when we extended the days prior to school starting for professional development as well as teacher prep time to develop these engaging lessons. And I'm looking down and I believe that we are in good shape. I think what steps are being taken to help students that select remote, building relationships with teachers, i.e. Freshmen, but it goes for everybody. So let me say this, and I didn't mention this before, and that's a great question that you pose. Whether it's remote learning or the traditional learning, we're going to spend the first 2 days of the year talking about social emotional learning, the importance of that, dealing with any specific questions that students have. What does it look like? Really spending those 2 days developing deep relationships with our students. Now, again, walking around the district as I have every single year that I've been here, I see unbelievable work in the hallways, unbelievable work in the classroom, specifically those first couple of days, really having teachers develop those relationships. But this year, we're going to be even more specific. We're going to be even more intentional and make sure we spend that time with the student. So we're going to ease into the year, as we know. And if there's some teachers on this call right now, we know this may be the first time you heard it, but ultimately we really need to spend time to help students transition back into the school year. These times are, I don't even say unprecedented anymore. I just say crazy times. They flat out are. When you look specifically at things that have occurred in my 54 years of life, we've never received training on this pandemic and what to do with schools. We have done a great job collaborating with other superintendents, with other organizations, with community organizations to provide as much as we possibly can for our students. We have plenty of time right now to really up our game. So our lessons are going to be more intentional when it comes to remote learning. We're going to be able to provide Wi-Fi more intentionally for our students and families. We're going to be able to continue to do food distribution for those that are in need. And again, great partnerships that we have, the Princeton Closet, St. Monica's, the St. Michael's Church, Valley Boosters. I mean, the list, Compass Church, it goes on and on and on, and great support from many, many different entities. And we certainly appreciate the unbelievable support. Again, the Presbyterian Church, the Methodist Church in Sharonville, and list literally goes on and on and on. So we certainly appreciate the great support we have from the community. We're going to continue to be intentional in the decisions that we make. And one more time, I would encourage you to make sure that you go to our website. If there's some additional questions that you have, check that FAQ section that we have on our website. And if there's answers that you need, please make sure that you reach out to us. We want you to make the most informed decision. And for those, once again, for those that really feel a little still insecure, even by July 14th, we will be very intentional. We need to reach out to everybody to get everybody completing that survey to make sure that we have all the information we need to have a smooth opening, a great transition, and most importantly, to continue to empower each student for college, career, and life success. And of course, I'd be remiss if I didn't end like this, because I'm very proud of our Vikings. I'm proud of the great work that's done. And once again, I'm proud to be superintendent of Princeton. And as I always end, go Vikes.